study reveals drug use and binge drinking, not COVID vaccines, behind sudden deaths. The shocking truth behind sudden deaths: it's not the vaccines. In a surprising revelation, the Union Health Ministry has stated that the alarming rise in sudden deaths among young adults is primarily linked to drug use and binge drinking rather than COVID-19 vaccinations. This finding challenges common assumptions and raises critical questions about lifestyle choices and health risks. A recent study conducted by the Indian Council of Medical Research (ICMR) and the National Institute of Epidemiology (NIE) has provided compelling evidence that receiving 2 doses of the COVID-19 vaccine actually lowers the risk of unexplained sudden death. This study, which spanned from October 2021 to March 2023, focused on healthy individuals aged 18 to 45 who succumbed to unexplained causes. Key findings of the study: the research involved 729 cases of sudden death and 2,916 control subjects who were healthy. It was found that factors such as a family history of sudden death, binge drinking within 48 hours prior to death, and the use of recreational drugs significantly increased the likelihood of these tragic events. Union Health Minister J.P. Nadda emphasized that the study concluded COVID-19 vaccinations do not elevate the risk of sudden death among young adults. Instead, it highlighted that previous COVID-19 hospitalizations, genetic predispositions, and certain lifestyle habits are more influential. Moreover, the study noted that engaging in vigorous physical activity shortly before death was also linked to these unexplained fatalities. This adds another layer of complexity to understanding sudden deaths, suggesting that not all physical exertion is beneficial, especially in certain contexts. Additional insights from AIMS Delhi. In conjunction with the ICMR, AIMS Delhi conducted a separate study to identify common causes of sudden deaths in young adults. Preliminary data indicates that heart attacks or myocardial infarctions remain the leading cause of sudden death in this demographic. Notably, the patterns of these causes have not significantly changed compared to the years preceding the COVID-19 pandemic. What does this mean for young adults? These 2 studies collectively provide a clearer picture of the factors contributing to sudden unexplained deaths among young adults in India. They reveal that while COVID-19 vaccinations do not pose an increased risk, underlying health conditions, genetic factors, and risky lifestyle choices are critical contributors. Let's discuss. This information may stir up differing opinions. Do you believe that lifestyle choices are the primary culprits behind sudden deaths? Or do you think there are other factors at play? Share your thoughts in the comments below. What do you think about the role of vaccinations in this context? Let's engage in a meaningful discussion. ICMR study debunks COVID vaccine sudden death link. Key risk factors revealed. In a world where misinformation spreads faster than ever, one claim has stood out: the alleged connection between COVID-19 vaccines and sudden deaths among young adults. But here's where it gets controversial. What if this widely discussed link is nothing more than a myth? A recent study by the Indian Council of Medical Research, ICMR, has stepped in to debunk this narrative while shedding light on what truly increases the risk of unexplained sudden deaths. Union Health Minister J.P. Nadda shared groundbreaking insights from the ICMR study, emphasizing that receiving the COVID-19 vaccine does not heighten the chances of sudden death in young individuals. Instead, other factors like past hospitalization due to COVID-19, family history of sudden fatalities, and certain lifestyle behaviors emerged as significant contributors. This revelation challenges common misconceptions and raises important questions about how we interpret health-related risks in the modern age. To arrive at these findings, the ICMR collaborated with the National Center for Disease Control, NCDC, and adopted 2 distinct investigative approaches. The first was a retrospective case control study designed to identify specific risk factors tied to sudden deaths. The second involved a forward-looking strategy using virtual autopsies to examine cases of unexpected fatalities among young adults. These methods provided a comprehensive understanding of the issue, combining historical data analysis with cutting-edge forensic techniques. When addressing concerns during a Q&A session, Nadda elaborated on the details collected to the study, Researchers meticulously gathered information about participants' vaccination status, prior infections, post-COVID conditions, family medical histories, and even their habits, such as smoking, alcohol consumption, recreational drug use, and intense physical activity within 48 hours before death, or interviews with surviving family members. This level of detail allowed scientists to paint the clearer picture of potential triggers. One of the most striking conclusions: receiving both doses of the COVID-19 vaccine actually decreased the likelihood of experiencing an unexplained sudden death, a finding that should reassure skeptics worried about vaccine safety. On the flip side, several alarming patterns were identified. For instance, individuals who had been hospitalized for COVID-19 previously faced higher risks, as did those with a family history of sudden death. Other culprits included binge drinking shortly before death, near the interview, substance abuse, and engaging in high-intensity workouts just days prior to passing away. Experts further unpacked the complexity behind these incidents, pointing out that underlying health conditions, genetic vulnerabilities, and poor lifestyle choices all play critical roles. In simpler terms, it's often a combination of pre-existing issues and risky decisions that leads to tragedy, not the vaccines themselves. Yet, this nuanced explanation doesn't always make headlines, leaving room for confusion and fear to persist. And this is the part most people miss. The bigger conversation isn't just about disproving myths. It's about fostering awareness around real dangers. If you knew your daily habits could influence your long-term health outcomes, would you rethink some of your choices? Or consider how much responsibility lies with public health systems to educate communities on mitigating preventable risks? So let's open the floor for discussion. Do you believe enough is being done to clarify the science behind vaccine safety and sudden deaths? Are there areas where research could go deeper? Share your thoughts in the comments below. We'd love to hear your perspective.